Estás viendo Canal América, televisión dominicana para el mundo.
A Time for True show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and I welcome you back. It's always a pleasure to be with you. Tonight, I know we're going to have something very interesting for you. It involves nutrition, wellness, and how to test for it. Something very innovative that was developed that we're going to introduce you to. And we're very lucky to have all the way from Clearwater, Florida, Dr. Freddie Ulan. And Buddha, if you put his pictures up on the screen, and I will introduce our viewers to Dr. Freddie Ulan, board-certified naturopath and board-certified clinical nutritionist, and there you see him. He's a doctor of chiropractic, unbelievably, for over 58 years, helping patients with pains and aches and numbnesses and different kinds of systemic problems like cardiovascular, digestive disorders, chronic fatigue, which so many suffer from, and other ailments. He's the founder of Ulan Nutrition Systems Training Academy in Florida, and also the founder of Ulan Nutritional System Office in Clearwater, Florida, that he established over 18 years ago. He's a scientific innovator of nutritional response testing and graduated from Chiropractic Institute of New York. He's the author of many and varied nutrition response testing manuals and is an internationally acclaimed speaker. He teaches doctors from all over the country so they can help their patients and keep them well. And Buddha, if you bring him up live on the screen, I want to bid a warm welcome, Dr. Freddie Ulan, to A Time for Truth show. Thank you for being on with us tonight, Dr. Ulan.
Well, thanks, Dr. Fialkoff. It's always a pleasure to see you. We haven't seen each other in about, 10 years, it feels like, but maybe, but you haven't changed a minute, even a bit.
Well, I got to give you a lot of thanks, but I tell you what, I won't give away your age because you're only 45, but I'm going to tell the viewers that this guy is the epitome of what he teaches, and you can see how healthy he looks. You know, sometimes I have speakers talk to me, and I look at them, and they're not the example that they're expounding. And here you've got a guy who is. So let's get started with the show. So I wanted to ask you, Freddie, what were your dreams when you were a young guy?
Well, I've thought about that, Bernie, and one thing I can tell you is I never dreamed that I would be doing the work that I'm doing now, which is really dedicated to the future, dedicated to bringing about healthy children. by educating their parents to how to be healthy and how to raise kids healthfully without drugs and surgery. Now, I mentioned that because in my youth, my father was he was one of these crazy guys. He was a zealot, a chiropractic zealot. He had a very serious athletic injury. He was a weekend warrior. You know, they worked hard. He worked in the New York Garment Center during the week, and on the weekends they played blackball, handball, very fast, hard game. And he experienced an injury, turning his body, you know, a pivot, and he just blew his knee out. And he was crippled, basically. He couldn't walk on it, finally with crutches. He went to several different medical doctors based on who his friends referred him to, different orthopedic guys, and they all told him that he absolutely needed surgery, but that they had no way of knowing if it would help. So he, being kind of afraid of knives in the first place, just kept on not doing anything, and he'd kind of be dragging his body around with crutches down on 38th Street in the Garment Center. And one day, one of his acquaintances saw him and said, "Hey, Artie, what's happening with you? You look terrible." He goes, "Oh yeah, I have this knee, it's, you know." And the guy said, "Come with me to my chiropractor." He goes, "Chiropractor? I don't know nothing about chiropractic." He dragged him, literally dragged him into a chiropractor's office. The chiropractor, during the examination, fixed his knee. And it was such a miracle, literally. He was turning the knee to see where it was locked. And when he put it in a particular position, which I learned how to do at chiropractic college many years later, that disc just sprung out clear again, and he was out of pain. And he got up and he walked. He goes, "This is a miracle. I have to tell everybody this." My father became a zealot for chiropractic, and as a result, I would experience him causing people with all kinds of incurable illnesses to be cured. And I was always interested in that, but I never actually thought I would be doing it. And so a turn of events occurred because back in those days, back in the 50s in high school, you were taught, you had counselors who would tell you what you needed to study. And back in those days, they were pushing everybody into engineering schools. And that was what the president wanted. So I remember this counselor sitting down with me and saying, "Well, Freddie, you have mechanical inclination. We can tell this. So you should become an engineer." I said, "Okay, I'll become an engineer." Enrolled in engineering at University of Florida engineering program, and discovered that I could not understand calculus. And I could not understand the type of chemistry that they were teaching.
Oh yeah.
And I had a horrible time with it, and it was just really very, very disappointing, and I was kind of despondent. And I remember at the end of that year, I was home, and my father said, "Well, what are your plans?" I said, "I can't go back there. I mean, I can't understand what they're talking about."
Right.
And he looked at me and he said, "Well, you got to do something. You know, back in those days, if you were 19 or 18 years old and you didn't have a plan, you were considered, something's wrong with you."
Sure, absolutely.
And he said, one day, he said, "Have you ever thought about becoming a chiropractor?" And I went, "Wow, what a great idea. I love chiropractic. I went to chiropractors. I used to give people adjustments because I learned from watching the chiropractors adjust my father's friends and our family, that as a teenager, I used to, my friends would want to play cards, and I didn't like playing cards, so I would always sit out. Somebody else would sit out, and I would adjust that guy, and then he'd go back in and play. And I said, "Wow, why didn't I think about that?" And that was just a perfect match for me, because you know what? I was mechanically inclined, and a chiropractor corrects body mechanics. That's the way it does it. The whole theory of chiropractic is based on, if your body is mechanically aligned and if it's mechanically functional, the nervous system can work and you will be healthy. And so remembering all the incredible miracles that I witnessed as a child of all these people, my father would just find people who were dying of this or that and had terrible illnesses, and he would drag them into a chiropractor. Literally, the way he was dragged, that's the way he would treat these people. He'd say, "Come with me," and I would be there so many times, and people were getting well. And so I went into chiropractic with that dream of just curing people without drugs and surgery.
What a beautiful story. I got to tell you, is like, it's almost like fate, guided you. And it's the story of your father is so amazing. And, I want to point out, because we're both doctors, and sometimes you get these decrees from a doctor, and depending on what they say to you, I hurt my shoulder almost a year ago now. And for about 3 or 4 weeks, I was afraid to do anything. People said, you can't move it, you can't do this. And I found an orthopedist, and he seemed like a good guy to me, so I wanted to go to him, and I did. And the guy examined me. He had laid my apprehension, and kind of like this guy that you talked about, the chiropractor, he said to me, well, no, you can raise your hand, and, in fact, you should start doing that, because otherwise it's not a good thing. You should put it into motion again. And I did. I went right back to my office, much higher spirits, and it started going away. And, I really have to thank him. So your story is another proof of that, of finding the right doctor with the right emotion. But, so you have so much experience. So share a few stories, because you have 58 years of helping patients. So share a few stories about some things that you've done over your 58 years, to give some patients out there who may have a similar experience some hope. Please.
Well, of course, the thing people always equate with chiropractic, at least they did back then, back in the 60s. I was in practice. I graduated in 1965. And if anybody wants to do the math, that would kind of give you a little bit about my age right now. And I looked around 16, so I grew a mustache to see if I could look older, and they just said that I looked like a young guy with a mustache. So I shaved that off and never grew it back again. But but people started coming in. I opened a practice in North Miami Beach, Florida. My parents lived in that area, and this was a Jewish retirement area. And we were the people who were coming in were retired Jewish folks from New York and Chicago and places like that. And they would come in and they would say things like, "Where's the doctor?" And I'd say, "What do you mean? I'm the doctor." He'd say, "No, you must be the doctor's son." I said, No, I'm the doctor. And, this was quite a challenge, dealing with people who they thought I was their grandchild,
You went through the same thing I got to tell you, you went through the same thing as me. Because when I did the same thing. I don't know. No wonder we're on the show together. I grew a mustache. I tried to figure out how to look older. Go continue. I'm sorry to interrupt you, but I had to tell you.
It didn't work. And matter of fact, I finally went the exact other way, because this was during the 60s, during the love child stuff and the hippie stuff. And I was not a hippie in any way, shape, or form. But amongst some of the younger people who came in were some people who were right into hippieism, with the bell bottoms, the big flowery shirts. And there was a gal there who, she had terrible menstrual cramps, and she was a young lady. She was in her 20s, so she was a little older than me, because she was in her mid-20s. I was in my early 20s. And she was so thrilled with the fact that a few adjustments, and that was the end of her menstrual cramps, that one day, as a thank you, she gave me love beads. She put them around my neck. And I just left them on all day. And it got so much chuckle and so much, interest from my retired Jewish clientele who would say, "Doctor, you're the doctor. What is this with the beads?" I said, "They're love beads. This is a place of love. We love you, so we're going to help you." And they would say, "Good, wear the beads." So I went from trying to look older to looking a little bit like kind of a hippie. I was wearing a white clinic jacket back in those days, because that's what chiropractors did then. Today they're a lot more casual, and I had my love beads. So that's one example. Many of these people, all of them had arthritis. All of them had joint pains. All of them had, many of them had ulcers and various neck aches and back aches. And this is what they came for. Now, I gave them a lot of relief. These people needed adjustments. If I gave them adjustments, they wouldn't have to take pain meds.
Wow.
And so they loved this. They would initially come in a few times a week, and then finally two times a week, and then once a week. And the ones that were in really good shape, they would hold their adjustments for weeks or a month or so. So I would see them once a month, and and they would keep their blood pressure down. I was just thinking of a very, very funny story in my early practice days.
Yes.
I don't know if I could relay this on public television here like this, but
go ahead. Go ahead.
It was a newly married couple. He was 92 and she was 88.
Wow.
And they came in, and the problem was his blood pressure was high, and he was worried that during his honeymoon, which they were on, he was liable to die while enjoying his marital nuptials,
right?
Because of his blood pressure. And he asked me, he said, "Can you get my blood pressure down?" I said, "Well, I'll sure try my hardest, you know." And I'd take his blood pressure. He'd come in, he'd say, "Okay, take my blood pressure." I'd give him an adjustment. He'd say, "Take my blood pressure." And if it would come down, usually, and if it didn't, he'd say, "Give me another adjustment." And I would give him another adjustment until his blood pressure would come down. And then he would take his wife and say, "Come on home quick." Before my blood pressure goes back up. Yeah. So that was
funny.
You know,
you're not only a very effective doctor, you're also a very humorous one.
well, you know, life is fun when you're doing good things. Good things happen, and to enjoy to help this old guy, this 92-year-old guy who's, you know, he's only 13 years older than me right now, and he'd just gotten married, and they were so in love. You know, you could see this couple. They were just like teenagers in old bodies, and I thought, God, you know, I'm going to help these guys. So from the whole, you know, the huge number of these people with aches and pains and the arthritic pains and things like that, chiropractic was wonderful for all of that. And I thrived on it. The problem, I was a little bit disappointed in that it took longer to get sick people well than it took in the 1940s and early 50s, than when I watched the other chiropractors getting people well by the 70s.
Now, why do you feel, why was that happening?
Well, I didn't know why initially. I found out later. But what happened is that during the years of the 50s and 60s and 70s and onward from there's been a gradual increase in the deterioration of the food quality and an increase in the amount of industrial toxins that are in the air, that are in the water, that get into the food. So the things that are so essential to the body to be able to constantly regenerate itself and create, genuine replacement parts, the things you put in there to do that, we're losing quality. When you add to that the increase in commercial farming, where the farms were starting to amalgamate into bigger farms, and the economics of farming were changing so that there was so much travel. Food had to travel long distances, so they had to, and they had to have big crops and pesticides and all this stuff. All these things were adding up and making it more difficult for the body to just normalize when you took the pressure off the nervous system.
Wow,
So
is that how you developed this nutritional response testing?
that's actually the seed of it, because I myself was in the peak of my health in 1986. I remember, because I commented on it to several people. You know, I'm at the peak of my health, and I'm 42 years old here, And I can't. I love how good I feel. And that was almost like I should have knocked on wood when I said that, because in the ensuing years, the next 4 or 5 years, I started losing my health, and I couldn't figure it out. And by 1991, I was in bed 24 hours a day. I couldn't get out of bed. I had double pneumonia for over a year, and which made it almost impossible to sleep, by the way. It's very hard to sleep when your lungs are full of fluid. And when I would get up, because I'd have to get up and walk around a little bit, any exertion caused pain and would cause a fever to occur. So if I exerted myself, I'd be in pain, and I have a fever of 102. And then if I lied still, the pain would finally go away, and then my fever would go sub. And the whole time I had my lungs full of fluid. And being a chiropractor, I had the best chiropractors in the area coming and making house calls. And God, I was at one point I was getting 3 adjustments a day. That's how little they were holding. I finally went to a friend of mine who was a medical doctor at that time, who was one of the more advanced ones. He was something called an alternative medical doctor. That didn't even exist back then. It's actually a female. She was considered weird by her colleagues, that she would look for causes of things rather than just slam people with symptom suppression, drugs. And she discovered that there was a laboratory that had just opened in San Francisco. It was the only laboratory in the world that tested for immune factors. Wow, what a concept! Today we take this for granted. And she had somebody come into my house, take my blood, and send it up to the lab. And I got a phone call 2 days later saying your blood was contaminated on the way over. We have to do that again. And so they did it again. And again, a few days later, I got another call. Your blood was contaminated again. So they did it one more time. And this time they called me up and said, Doctor, it wasn't your blood is contaminated. Your blood is contaminated. We've never seen so many different viruses and bacteria and fungus and parasites and things like this. And it was like, you don't really have much time left, is what they told me. And I ended up knowing that the worst thing that I could do at that point, because my immune system was so weak, that the worst thing I could do would be go into an American medical hospital, because people used to die from hospital staph and hospital strep. These are the bacteria that can survive the massive amount of antibiotics that are used in the hospitals. And these are everywhere in the hospitals. I knew that I didn't have the capability of surviving exposure to that kind of bacteria in that condition. And we ended up, my wife did some research and she said, we're going to Mexico. And at that time we were living in Southern California, so it was only a 3.5-hour drive to Tijuana. We went to the American Biologics Hospital. They were complimentary. In other words, they did all these things that were illegal in the U.S. and definitely not acceptable for medical doctors to do, including homeopathy, dioxychlor, but they had their own garden. and they would make me fresh juices with a Norwalk juicer every morning. And they started giving me IVs, vitamin IVs, and they gave me this terrible drug called dioxychlor. Cleared my pneumonia in 4 days. Still illegal in the United States for humans.
Is that basically like the chlorine in a pool, or?
Yeah. No. Well, no. It has a similar. It's actually.
I know that there's a water I know that's being propounded. I won't say the name, and it tastes like pool water. And is that something similar to that, or?
Well, I will tell you that I didn't get the taste of it at that time because they gave it to me IV.
Oh, I see. Okay.
Just put it in my arm by needle. And when I asked the doctor, I said, "What is this?" Because how come I'm breathing? I'm suddenly breathing. My lungs are clear. 3 days, my lungs are clear. A year, everything I tried couldn't clear my lungs. He said, it's the dioxychlor. I said, what is dioxychlor? He said,
right.
It's simple. It's simple chemistry. Dioxy, 2 oxygen molecules per chlorine molecule.
Yes.
And when you put that in the body, it breaks up. The oxygen breaks off the chloride, leaves the chloride, which is like from sodium chloride, and
Yes.
the oxygen kills the bacteria. And I went,
Wow.
what? Why don't they do this in my country? They said, there's a problem there. The pharmaceutical companies won't allow it because there's
Well,
no
let me
profit.
tell you, Freddie, because you and I are having such a great talk. We have 2 minutes left, and I'd
Oh
like
my
you
God.
to at least give the viewers a little bit about nutritional response treatment,
All
please.
right.
Real quickly.
That experience left me with a very interesting situation, which was that I was no longer dying, but I wasn't well enough to work. I could be up for 2-3 hours. And it was like, okay, how do you repair a body that has been so beat up? And when I realized that it was beat up from the fast foods that I was eating and the basic American diet that I was eating, because I had no care about diets back then, and that I had mercury poisoning from the dental work that I had. You know about this from your past. And
Sure.
I all these things had to be addressed. And I had to, and there was no system for knowing how do you go about doing it. Everybody had their own opinion, and most of them were overwhelmed. You had to do so many things at the same time, it was absolutely impossible. And I ended up over the years evolving a system that enabled any practitioner who I trained, and I've trained several thousand of them now, that they can tell you, they can assess the body. It's using a non-invasive type of testing. That's the system, much too much to go into in this broadcast, that will tell them, okay, what are the barriers to healing that have to be overcome? Is it problems with food? Is it a hidden immune problem? Is it chemical problems? Is it metal problems? Things like this. And what sequence do they need to be handled in? Because you have to handle these things delicately. The handling of them, if they're done too fast, can cause their own problems. And so, and while you're doing this, what nutritional support does the person need, and how much of this can be done nutritionally? And that was the big breakthrough for me, was discovering that I could handle these barriers, these hidden causes of illness with nutrition, and I could support the body, specific organs that needed support while we were doing this. And that became what is now called nutrition response testing.
Amazing.
That was it.
So you know what? We've run out of time on the show, but first of all, I want to thank you for being on the show because it's very, very entertaining and informative.
Well, I always enjoy, you're a good listener, so you ask me good questions and you're willing to listen to my answer. I love telling the story because people tend to be inspired by it. I mean, I just turned 79 last week. And
I got to tell you, you're a testament to what you're preaching. And, I got to tell you, if at all we can get you back on, I would love to have a show where you can continue into the nutritional response therapy because it's so important. Unfortunately, we got to end off, but I want to thank you. And for the viewers out there, if they want to reach you, what is your email?
I could be reached at, try this, Dr. Freddie, Dr. Freddie, Freddie, 4, @gmail.com.
There you go. So if you want to reach Dr. Ulan, you email him and we'll cause a big uproar so he comes back and gives another show for us. So thank you, Dr. Ulan. And for those of you watching, have a great week. This is a Memorial Day. Let's play honor and, and really remember all these men who fought for our liberty and our freedom. Thank you for having tuned in. Happy Memorial Day.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet